Welcome back to the stream. We appreciate you joining us.
Yeah.
The FDA has approved an updated COVID-19 booster shot.
And those new vaccines could be available in the coming days, as the CDC expected to approve the booster today, so we could know more soon. Joining us now is Dr. Katrine Wallace, Dr. Kat.
Epidemiologist at the University of Illinois, Chicago. Thank you for joining us, my friend. Always breaking down the latest COVID-19 news for us with authority and in layman's terms, which we appreciate.
Oh my goodness, we always appreciate that, Dr. Kat. So let's get to it right now. The U.S. has seen about a 10% increase in COVID-19 deaths. We've also talked about this increase in hospitalizations we've seen in Chicago due to COVID-19, up about 13% since last week. So we talk about the spike in cases. We also have been talking about, you told us about the EG.5 variant. So a big question, will this booster provide any defense against this variant?
It will. Actually, the good news is that this variant that is circulating now is a very close cousin to the variant that the vaccine is targeted to, which is XBB.1.5. And in fact, that one is still circulating also. So yes, it will provide good protection. And we have some data from Moderna from earlier this summer showing that it will target EG.5 very successfully.
Ed, can we get Dr. Kat a glass of water? She's remote, but Ed's our meteorologist. He works magic. So, Dr. Kat, so it has been almost a year, right, since the last COVID-19 updated booster shot. According to the CDC, only 20% of people in Illinois are up to date on their COVID vaccines. So this is kind of a twisty question, but if people haven't gotten that one,
yep,
should they get the new one, or do they get the last one first, or are they supposed to remain ordered? How does this work per what
So
the
that's a
government
fantastic question. And we're now kind of moving away from counting boosters.
Okay.
And this new vaccine is the updated vaccine for fall 2023.
Okay.
And so it's now going to be kind of thought of as part of your fall wellness routine, like the flu vaccine, where the vaccine will just be updated for the circulating strains that are going around, and you no longer need to worry about previous versions of the vaccine. In fact, yesterday's FDA decision to approve the new one took away the approval for the old one, so that one will no longer be available.
Oh, that's good to know. So you said only 20% of people in the county have it, so this could be their first one.
Yeah, in the state.
In the
That's
state,
right.
correct, yes. All right, so this is also the first booster shot since the White House said we are ending the public health emergency declaration. So people are likely wondering, a big question, will we have to pay for the booster now, especially those who are uninsured or those who have Medicare?
So, of course, people who are insured under a commercial insurance plan, Medicare or Medicaid, will still continue to get the boosters for free. There is also a Bridge to Vaccines program that the CDC is sponsoring that is through December that should be able to cover these new vaccines. So if you are thinking about getting one and you're uninsured, I would get it before December. After that, the White House has a plan also, but that one, I'm not sure of the details quite yet.
5-second, just yes or no sidebar question on this. You and those in your community, are you frustrated with the White House downgrading it and not making it an emergency now, because now people are like, not that big of a deal?
I think that it is good to take it seriously, but we are in a very different place, like we discussed last time.
Okay.
We are seeing an uptick in cases and hospitalizations, but we still are at a much lower level than we have been in other parts of the pandemic. So we do have some tools now that help us be in a better place.
Yeah, so not appropriate to no longer describe it as a emergency, if you will. Okay, so we've got the flu season coming up on the horizon too. Cold, it's getting colder, more indoor, intimate gatherings. What's the guidance about this, getting the flu shot, when, other illnesses, etc.? I mean, can you just tell me, like, okay, October 13th, get it and get all of them done, or what's the protocol here? Because you can get both jabs at once, right? The flu and the booster, so on and so forth. And what are you going to do? What are you going to tell your friends to do?
That's correct. You can get one in each arm, or, the flu and COVID shots can be taken together. Also this year, for people over the age of 60, we have an RSV vaccine,
Oh, wow.
which is
Okay.
available as well. So we have a lot on the horizon for fall protection. So yes, you can get them on the same day. You can also just other protections for fall, seeing as we are in an uptick is, obviously we know that masks are a nice protective layer that you can use when you're indoors. You can test before gathering with friends and family. Make sure you have good ventilation where you're going to be. Also, maybe avoid those crowds if you are in a group like an elderly group or a group that has other health conditions on board, or if you live or work with people in one of those vulnerable groups.
We appreciate you so much. Thank you for the insight and really the perspective on what we're looking at here as we await this approval. Thank you so much, Dr. Kat Wallace, epidemiologist with the University of Illinois, Chicago. We appreciate you.
Thank you, Brad and Audrina.
All right. Well, we see, again, that was Dr. Kat Wallace. I just spoke to her with all the latest updates, including now what we're hearing, vaccines for the flu and boosters. And she's going to be back here tomorrow with exactly who is eligible. And I'm sure we'll have much more to talk about, especially if we get that FDA approval.